Hi everyone, good morning, good afternoon, good evening, wherever you're watching me from. Welcome to Nostella's Corner. Welcome to the home of water must flow in your kidneys. You need to excrete waste products out of your kidneys. This morning we'll be discussing a little about dehydration. Dehydration. You always hear dehydration. What is dehydration? You notice dehydration occurs when the body uses or loses more than the amount of fluid that it produces or it takes. That is dehydration. When your body is losing or using more than the amount of fluid that you take in, the amount of water you take in, it leads to dehydration. So at the end of the day, once there is not enough fluid in the body again, it won't be able to, the body won't be able to work the normal way it's supposed to. So at the end of the day, you find out you're losing more fluid, and once you don't replace them, you get dehydrated. So be careful, ensure you take water. We emphasize at Nostella's Corner that you should hydrate yourself, you should take enough water. Because when your body is using or losing the fluid, it won't be able to, your body won't be able to perform its function well. So at the end of the day, you find out you're becoming dizzy, you're becoming dehydrated, as in you there is reduced urine. You won't be able to produce urine. Your outflow will be very, very low when it comes to urine. And you notice your urine will be concentrated too. That is another sign. You'll be yawning frequently. Your body is telling you, I need to be hydrated with more fluid and water. You notice you'll be having palpitation. Your heartbeat will be fast, uncontrollable, because there is no water to carry oxygen and even mix the blood and transport a lot of nutrients around the body. Then you notice your eye will be sunken. It goes in when you are dehydrated. You notice when you touch your skin, once you pull it up like this, it won't go back. It means you are dehydrated. You lack energy. You'll be so tired. Even at a stage, you'll be confused. You won't be able to concentrate well. You'll be confused. Whatever you are doing, you'll be notice series of confusion because you are not hydrated. You've not taken enough fluid. And you remember in my previous topics, I tell you take enough water, up 4 to 5 liters of water per day. If you can take more than that, good and fine. You are still on the right track. It amounts to 6 to 8 cups of water per day, which is very, very important. So please endeavor to take plenty water. What are the causes? What causes dehydration? You notice when you're having excessive diarrhea and vomiting, you have not controlled it, you've not really taken care of yourself, it ends up dehydrating you because you've lost a lot of fluid and even electrolytes, sodium, potassium, calcium. You notice you've lost all those things during your period of vomiting and having diarrhea. So when you notice you're having such, please go to the hospital, take enough fluid, take enough water. It will help you out. Then another thing, you notice all this illness that comes with fever, they end up dehydrating you too. Then when you have some medications too, makes you dehydrated. Some of the drugs they give you makes you pass a lot of fluid like laxis, furosemide. When we give, you find out you're urinating frequently, you push a lot of fluid out, and if you are not taking fluid back, it gets you dehydrated. Diabetes is another one that gets you dehydrated because you notice you pass out frequent urine when you're diabetic. You pass a lot of urine frequently, you go to toilet frequently. So please endeavor to take plenty water. It goes a long way helping you. Water is vital to life. Water is important, very very important. Water is important, is vital, is paramount to life. Endeavor to take water frequently, enough water per day. You notice you are sweating profusely and it gets you dehydrated. Make sure you take water very very well, please. And when you don't take water, you end up having heat injury. You end up having urinary tract infection. Your urinary system, your kidney start having problem when you don't drink plenty water. Because when you take plenty water, it helps you flush out unwanted product, waste, infection from your kidneys. So please endeavor to take water. If you are dehydrated, your brain too reacts. You start having seizure, you start convulsing. When you are dehydrated, when the brain is no longer having enough water to help itself to do the normal work, then you find out you start having low blood volume. The level of your blood will be low because water is not there to help you out. So, and it's called it you end up having shock, which we call hypovolemic shock. So you need a lot of water to take care of yourself. Then, how can you prevent dehydration? Drink plenty fluid. Take a lot of water. Very very important. It helps you. Eat food that can hold water. Fruits and vegetables, they are very good for you. Then you also take, don't take caffeine during the period of your dehydration. Don't take caffeine, please. Don't take it. Don't take soda. All these drinks that contains caffeine, that contains energy drink, please try and avoid it when you are dehydrated. Endeavor to take care of yourself. Take plenty water. It will really help you out. It will ease a lot of things. Please always adhere to whatever advice you're being given in the hospital. It goes a long way because once you are dehydrated, it ends up destabilizing you. So please endeavor to take water, take care of yourself. Take 4 to 5 liters per day. That is 6 to 8 cups of water per day. You don't end up drinking all these carbonated drinks because you want to rehydrate yourself. Water goes a long way helping you out. Thank you very much. Have a wonderful day.